All right, so now we're going to talk about a condom catheter or Texas. I don't know why it's called a Texas catheter. Do you know that? It's called a Texas or condom catheter?
No idea. No.
Yeah. A Euro sheath can also be called. All right, so it really looks, minus that, it really looks like the tip of a condom. All right, so make sure you have gloves on. It helps if you have cleaned but not have it wet. Now, you are going to put this on, because y'all saw the video, but you're going to put it on, and I'm not going to roll this down because it's going to be sticky. What you can do if you have tried using these on patients and they keep coming off, there is, if you can find these little sticks, and you break them, and then you break it, and then the liquid will come on here, and you're going to put it on your penis. Now, this, anybody know what this does? Do you ever use these?
No, I just use skin prep.
Yeah. These really help. If you have a patient who these keep coming off of, these help. It makes it, however, very sticky. So you have to put this all around the penis, but then the problem is you have to sit here and hold the penis and let it air dry, because it needs time to air dry to get tacky. When it gets tacky, that's what makes it sticky. All right. So this is also sticky. So now notice when you have on your gloves, this is what happens. I'm kind of exaggerating here to make it but see how it is really hard, and then your gloves stick to it. So generally what happens is you go to put this on, and then your gloves get stuck on it, and it's a hot mess, and then it's all happened to y'all, right? You can't get your glove out, so then you're like, okay? So what I'm trying to get the point across is inside here is very sticky, okay? That's what helps it stay on penis, and you want to roll it as far down as you can. Now, this always comes up in class. Either the male is very small, so it's hard to put these on. So how do you do it? And the answer is you do it the best you can, and you just keep rolling down. If also they have a lot of hair gets stuck in there because it's sticky, and it can be painful for the patient too. All right, so the other thing that comes up in this whole putting on a condom catheter thing is, or a regular Foley catheter, is what happens when the male starts to become erect. So, which will happen
Every time.
which will happen at some point in your nursing career. So, the correct thing, if you read in the books and the nursing literature, is to tell the male, if you need a minute, I'll come back, and is to leave and come back. However, I'm going to be honest and say, if you're putting on a condom catheter, it's great. It does help, actually, if they are erect. It makes it easier to put on. So, if they start getting erect, hurry up, put it on. Because it does help. Because there's more for it to grab onto. It's not that bad.
Once it goes back, is there going to be an issue?
No, because it's stuck on there.
Or when
Okay.
it goes, yeah, if it's...
Now, eventually, they don't stay on very well. If you can get them on and they stay on, that's great. But you're probably going to change this thing many times throughout your shift, at least if you're me, because they come off, or the patient's pulling it off, or whatever. So once it's on, then you would do the same thing you did with the PureWick, which is just connect it.
I would not connect that.
No.
Do you do this? Because what I want to point out is we didn't do the video of it yet. The male PureWick, you have to connect suction, okay? That's a different video, but what I'm trying to point out is here, you don't. Here, you'll see why you get confused when you see the other video of the male PureWick, because you do hook this up, okay? And people get very confused. I have gone in, this just happened 2 weeks ago on the unit. I have gone in, and a male had this on with this suction. So that's why I bring it up, and that's why I went to make that mistake to see if anybody was like, and y'all did what you were supposed to. But you can see why it's, if you're just learning, you can just think, oh, it's an external one, I just need to hook up suction. If it is a condom catheter, you don't. They urinate in it, it goes through the tubing, and it goes into the regular collection bag. Okay? A male, I don't know what it's called. We call it a male wick. does hook up to suction. A pure wick for a female does hook up to suction. Okay, so make sure you understand, because I about had a heart attack when I saw the suction on that. All right, and usually you don't have to worry about taking these off because they get pulled off or taken off before you actually have to take it off of the patient. All right, you can stop it.